I am Nadine Carty-Keynes, and thank you for joining us at the Nevis Emergency Operations Center, EOC, today, Monday, 24th August 2020, for an update on the situation regarding the novel coronavirus, COVID-19, here on Nevis. I want to thank you all for joining us this evening and thank our media houses who have joined us as well. All questions will be taken at the end after all persons would have presented. The Nevis COVID-19 briefing will be aired on Mondays at 8:30 p.m. here on Nevis Television. You can also look at the briefings on YouTube and Facebook pages of Nevis Television, Nevis HPU, Nevis NDMD, and Von Radio every Tuesday at 1 p.m. This evening we have with us Mr. Brian Dyer, who is the Director of the Nevis Emergency Operations Center, Superintendent Lyndon David for the Royal St. Kitts and Nevis Police Force, Division C, and Dr. Judy Nisbet, Chair of the Nevis COVID-19 Task Force. I want to welcome Mr. Dyer to provide his update from the EOC.
All right, good evening all. As usual, I like to start with some weather. Currently, there is no active tropical cyclone in the Atlantic. However, we have two systems in the Caribbean Sea that has traversed from the Atlantic Ocean. We have Marco and Laura, presently affecting the U.S. and the Western Caribbean at this time. We had an impact from Tropical Storm Laura on the weekend. And for us here on Nevis, we fared well. The rainfall collected, max rainfall collected at the New River Station, 63.60 millimeters, and at the airport, 40.48 millimeters. In terms of wind speed, we recorded 30.7 miles per hour at the New River Station. We continue our preparations for the Atlantic hurricane season, as this is again, all indication is for an active season, or extremely active season. We are just past the halfway mark of August, and we have seen 30 named storms thus far. The prediction is for 25 named storms. And I'll now read for you the monthly tropical weather summary from the National Hurricane Center. 5 tropical storms, including 2 which became hurricanes, formed in the basin in July. 1 tropical depression also formed late in the month over the far eastern portion of the basin. 5 named storms ties the record for the most named storms forming during the month of July, which was previously set in July of 2005. The season has been considerably more active than average so far, as typically only 1 or 2 named storms are formed prior to August, and thus far we have had 13. So far in 2020, 9 named storms have formed, including 2 hurricanes, Hannah and Isaias. In terms of the accumulated cyclone energy, which measures the strength and duration of tropical storms and hurricane activity in the basin so far in 2020, has also been above average and twice the long-term means. Again, this is saying that we are in extremely active hurricane season. The Atlantic Ocean is extremely warm, and the winds in the upper atmosphere is very light. So, tropical storm formation would be on the increase as we proceed to the rest of the hurricane season. I now switch to the COVID-19 report from our compliance task force. They have continued their vigilance with regards to visiting our businesses and offices. To date, they have a total of 1,018 visits. These include bakeries and delis 7, banks and finance institutions 13, buses, taxis, ferry 87, game rooms 9, gas stations 9, government buildings and departments 104, laundromats 3, market vendors 4, mechanic shops 17, offices 82, pharmacies 2, restaurants 28, salons and barbershop 24, shops 28, snackers and bars 60, stores 60, street vendors 11, supermarkets 7, funeral homes 2, gyms 3, car wash 3, wholesale 2, radio station and communications 2, manufacturing 10, hotels and guest houses 7, church visits 114, observations 310, others 10. Grand total 1,018. And that's it from my report. I would like to appeal once more to our persons in our communities to be prepared for the rest of the Atlantic hurricane season as we approach the peak in September and October. Thank you very much.
Thank you so much, Mr. Dyer. I'd now like to welcome Superintendent David, who will provide his update from the Nevis Division C.
Good evening all. Thank you, Nadine. As usual, I will start with some statistical information as to what we've been doing thus far during this period. Thus far, we have conducted 1,509 patrols, both foot and mobile. We have conducted 137 vehicle checkpoints. 66 arrests were made and 10 persons were charged. Thus far, we have seen 21 crimes reported during the period and 16 persons have been arrested. We have conducted 7,849 vehicle stops. 26 persons were informed that they will be summoned for the various offenses that were committed during this period. We have seen where persons are gradually adjusting to the new circumstances under which we find ourselves because of COVID-19 and the regulations. We see a number of persons are trying their best to comply. I just want to remind businesses and establishments to continue to ensure that staff and your patrons continue to practice physical and social distancing and ensure that your establishment is closed at a reasonable time so that persons can get home before the start of the curfew. It has been observed that many persons are failing to wear their face mask that will cover their nose and mouth. And we also observe that there are a number of people who are complying with it. Yes, it has been given to us in our new regulations that persons can be given a ticket. Yes, we are still waiting for those to be printed, but as soon as that is done, you'll be ticketed. But as mentioned earlier, that does not negate the fact that you can be summoned. We understand that there are many persons who may have their varying illnesses and you're exempted based on the new regulations. So we're saying to you, we understand. And we are encouraging persons who have young persons under the age of 18, but over the age of 3 years old, to ensure that they have a mask whilst they're in a public place. Failure to do so, you will be the one who will be held accountable and responsible for that fine. Just letting persons know that parties, beach picnics, and beach parties are still restricted, and we are encouraging persons to continue to comply. We've seen the majority of the persons are complying. We have listened to the persons who are entertainers and promoters, and we had a meeting last week, and out of that meeting was conducted with the National COVID Task Force. And they were told of a number of things. Yes, the new regulations catered for persons to apply to the Commissioner of Police with consultation with the National COVID Task Force for persons who have events that will gather large numbers of persons. So we're saying to you, you must apply and provide a plan that will entail social and physical distancing, your plan for that, your plan for hand sanitization, and the capacity in which you can hold those persons who will patronize. We look at sanitization stations and bathroom facilities. So, once again, persons who are applying and are desirous of conducting mass events that will have large numbers of persons, you are to ensure that you apply and submit your plans. With that said, I take this opportunity to thank God for his continued mercies on the Federation of St. Christopher and Nevis. We have seen where new cases have come up throughout the region. And I've seen where my colleagues my counterparts in other countries also have suffered, and also the militaries. So we are saying to us that we are so blessed. And we thankful for the government continued support, both local and federal. The members of the Royal St. Christopher Nevis Police Force here in Ireland, medical staff, Dr. Judy leading, the disaster staff headed by Brian Dyer, and also the media. I cannot do without the media. You know, the media help us to give you information and also to help us to listen to what you have to say as well. All those other essential workers who are making it possible so that we can continue to have this safe period. And all you citizens who continue to support us, we're saying thank you. Whether you're going to call us or you're going to do what is required of you. For those persons who continue to violate, we are saying to you, it is something that we all have to do to protect our federation and ensure that we do not see any new cases, and let us control the situation that we have. Thank you very much, and do enjoy the rest of the evening.
Thank you very much, Superintendent David. And now I'd like to welcome Dr. Judy Nisbet, who will provide her update as Chair of the Nevis COVID-19 Task Force.
Thank you, Madam Chair, and good evening to everyone. Now, in terms of the global situation of COVID-19, there are so far 23,311,719 confirmed cases of COVID-19 worldwide. Of that, 253,963 were new cases over the last 24 hours. 250,000 new cases over the last 24 hours. There have been so far a total of 806,410 deaths worldwide. Now, the region of the Americas has the highest number of cases, and the region of the Americas spans from the top of North America down to the tip of South America. And remember that we are nestled in between these two continents. Now, the region of the Americas has 12,423,028 cases. The United States leads the way with over 5 million, almost 6 million cases. Brazil has 3,582,362 confirmed cases. And Peru, Colombia, Mexico, over 500,000 cases each. And Chile and Argentina, over 300,000 cases each. So the Americas, this region of the world, has the largest number of cases. In the Caribbean, as of 3 days ago, on the 21st, there were 149,880 confirmed cases reported. But of those, 80,000 have recovered. And so far, we have had 2,439 deaths. On the island of Nevis, we have tested thus far 299 persons. 285 of these persons have tested negative. 4 have tested positive. And all 4 have recovered, so we have no one in isolation. We have in quarantine presently 23 persons. We have released 326 persons from quarantine since March, and we have pending 10 test results are pending. We have also on Nevis, to date, we have had 129 persons repatriated over the past 116 days, and 106 of those repatriated citizens and residents have been tested and released. In St. Kitts and Nevis, in total, we have recorded 17 confirmed cases. We have had 17 recoveries and no deaths. I want to take the opportunity to remind us, as we have been for the past months, that non-pharmaceutical interventions is all we have right now to prevent ourselves from being infected and to prevent others from being infected. We have no specific treatment for cure, and there's no vaccine that is available. We continue to encourage persons, therefore, to wear your mask in public places. Stay 6 feet away from others. And that is, you practice physical distancing from others. Wash your hands frequently and thoroughly with soap and running water. And if that is not available, to use an alcohol-based hand sanitizer with no less than 60% ethyl alcohol content. We ask persons to clean high-touch surfaces regularly throughout the day. Keep your hands, if they're unclean, keep your hands out of your face. And in doing that, you avoid touching your eyes, your nose, your mouth, and therefore you avoid transferring the virus to your mucous membranes, and in that way preventing yourself from getting COVID-19 if it's on your hands. Stay at home if you're sick with respiratory symptoms of any sort or fever, and contact your healthcare worker, your healthcare provider, and for advice before turning up at a healthcare facility, and therefore put others at risk. So you should stay at home, self-isolate from your friends, away from your friends and your family, so that you don't pass on the virus if it is that you have COVID-19, or even if you have the flu. You won't pass it on to other persons. Cover your cough and sneeze with a tissue, dispose of the tissue in a closed bin, and wash your hands immediately and thoroughly. We urge persons to stay away from crowded areas. We urge persons to stay away from crowded areas. Therefore, in doing that, you avoid close contact with others who may have COVID-19, and it is more difficult in a crowded area to maintain 6 feet distance from anyone. So that was just a reminder of some of the things that we need to do. Those are the non-pharmaceutical interventions that have proven to work. And we ask persons to take personal responsibility, since personal responsibility is community responsibility. Thank you.
Thank you, Dr. Judy Nisbet. I'd now like to welcome our media houses to provide or make any statement or ask any questions if so desire. Monique Washington of The Observer for Dr. Judy Nisbet. For clarity, for persons returning to Nevis that are required to submit a negative COVID test before arrival and placed in quarantine for 2 weeks, if there are no symptoms of COVID-19, should they still have to take a test at the end of the 2 weeks?
Thank you, Monique, for that question. Yes, when you take a COVID-19 test, it tells you the person's status at that point in time when the test is taken, provided that they have enough virus in their nasopharynx to be detected. As you can appreciate, some time is going to elapse between when they take the test and when they travel, and a person can become infected during that time. after they take the test, and even during travel. So it's important then to quarantine persons and to monitor them for symptoms, and still take the test at the end of quarantine in the event that they were infected, after taking the first test or during the flight, or if they were in the window period, for example, when they were tested in the first instance before they boarded the flight. Now, and you have to appreciate also that persons can be asymptomatic. So go through the quarantine period without symptoms, but still test positive at the end of the quarantine period. So this is why it's important then to test persons at the end of the quarantine period. Thank you.
Thank you, Dr. Nisbet. Daniel Moore, Von Radio. Can we get an update about the boat fire last week? Superintendent David.
Thank you very much for that question. I would say that thus far we have conducted a number of interviews with persons. We had persons who were taken into custody where that is concerned. They have since been discharged. Our investigation continues. At this time we are appealing to members of the public who may have valuable information to assist us in our investigations to ensure that the perpetrators for this crime brought to justice. So, yes, we are conducting our investigations, and we will continue to do so. And we're asking members of the public to assist us in these investigations. Thank you very much for your question.
Thank you so much. That's it for the end of our question and answer segment from our media houses. So I'd like to take this opportunity to thank all our presenters this evening, and thank you, the media houses, for joining, and also you, the viewers. And of course, you know exactly what to do to protect yourself from COVID-19 to minimize the risk. But I'll just gently remind you real quickly, wash your hands with soap and water. If you don't have access to soap and water, use a hand sanitizer. Cover your cough and your sneeze properly and wash your hands after. Avoid touching your eyes, nose, and mouth with unclean hands. Disinfect touch areas often. Practice physical distance or social distancing. Use a face mask when out and about in public. And stay at home if you're sick. Persons are reminded that COVID-19 symptoms can include, but not limited to, fever, cough, shortness of breath, loss of appetite and smell, runny nose, sore throat, etc. I want to say thank you to the Nevis Disaster Management, Nevis Television, Caribbean Digital Display Limited, Cornerstone, staff of the Health Promotion Unit, and the Nevis COVID-19 Task Force members for making this briefing possible. I am Nadine Carty-Keynes, and please join us again for another EOC COVID-19 briefing on Nevis Television on Mondays at 8:30 p.m. Thank you for viewing, and please do stay safe.